palpitations, skip beats, flutters. Something's not right in my chest. These are among the common things that my patients typically present to me with when I'm seeing them for the first time, whether that's in the hospital or in the outpatient setting. So what exactly are causing these palpitations, or what are these palpitations? So the exact thing is, we don't know until we do further testing. We can make assumptions of what it is based on our previous experiences, but one of the things we must take into context is that each person's experience, each physician's, each healthcare experience differs from person to person. So if someone presents with palpitations, I want to get a few more information regarding it. The most important question is, are there any triggers? Specifically, are there any foods that can trigger this? I've found that things that are highly caffeinated are one of the biggest triggers. And from that, we can make some guesses of what we think it is. The most common being things like a premature ventricular contraction or an extra beat that comes from the bottom part of the heart. A premature atrial contraction, same thing, but from the top part of the heart. But we don't just want to rely on what our guesses are, we want to get evidence of this. There are multiple ways that we can do this. The first primarily is from doing an EKG, an electrocardiogram, where we look at the heart rhythm itself. We'd be lucky if we finally figure it out just with that. Why? A lot of times when the patients present and they get the EKG, for some reason, we don't know why, but their heart always acts perfectly. It tells us a lie. This means that we need to get more information for a longer period of time. And we see this happen a lot in the world of cardiology, where their primary care provider, primary medical provider has already done this for us. Sometimes they'll do a 24-hour monitor, a 48-hour monitor. I've found that we need a little bit more time. Ideally, we would like something like a 15 to upwards to 30 days, so we give you the most opportunities to finally show us what it is. The premature atrial contractions, the premature ventricular contractions are quote unquote benign, meaning that it will not kill you. But depending on how often it's occurring, specifically if you're having 30%, 40%, it can be very uncomfortable and lead to a very miserable life. When that occurs, we start to look at having you being seen by an electrophysiologist, which is a cardiologist that specializes in abnormal heart rhythms. There are some individuals who fall in between needing the electrophysiologist versus just watching. And for those individuals, we have multiple medications that we can potentially utilize. Also trying to look for potential causes of this. Things like sleep apnea, things like abnormal electrolytes, potassium, significant stressors, ischemia itself, blockage of the coronary arteries. And for those individuals, there are medications that we can use. Sometimes we need to do further testing to make sure there's nothing structurally wrong with the heart or the heart arteries. And other than the PACs, PVCs, atrial contractions, ventricular contractions, what else can it be? We have things like atrial fibrillation, which is an abnormal rhythm that comes from the top part of the heart. What makes this extremely more dangerous and scary is that if it happens for long enough, and if you have enough risk factors, including hypertension, diabetes, heart failure, age greater than 65, prior stroke or TIAs, it only increases your risk of having a stroke, meaning that you would need to be on some preventive medications, aka blood thinners, to prevent a stroke from happening. Other things include things like ventricular tachycardia, ventricular fibrillation. Usually, if you're having ventricular fibrillation, you're not going to be on an outpatient setting. You're going to be in the hospital because it's such an abnormal rhythm that the heart is basically fibrillating to the extent that you're not getting any blood flow to the bottom of the heart. aka your heart's not beating at all, which leads to sudden cardiac death. Usually someone who's having ventricular fibrillation presents as death. So they need CPR, they need a defibrillator, and they need extensive workup to figure out why it's happening. But just to summarize it, if someone is having abnormal heart rhythms, palpitations, we do an EKG first, and then we switch to a monitor that can go anywhere from 24 hours upwards to 30 days to figure out what exactly is going on. Once we figured it out, we can do nothing. We can use medications. We can look at preventable, treatable risk factors like sleep apnea. But if that's not enough, medications and potentially having someone seen by a specialist known as electrophysiologist who can look at different therapies, including medications and possibly an ablation, a procedure used to find out where that rhythm is coming from and basically get rid of it permanently. My name is Dr. Isang. I hope you found benefit in this video. If you have, give me a like, subscribe to the channel.